my name is Dannine and I'll be your nurse today. Can you tell me what your name is?
Devin Clark.
And Devin, do you know why you're here?
For physical?
And do you know today's date?
Yes, May 11th, 2020.
Do you know what month it is?
May.
Do you know who the current president is?
Trump?
Okay. Now we could note on Devin that when she came in, her posture is good. Her general appearance is good. When she came in through the door, she had an appropriate gait. She's not showing any signs or symptoms of distress. Her balance wasn't off. And so now we're going to move into her head. We're going to just feel around. We're checking for any lesions, masses, or lumps. Devin, do you have any problems with your head?
No.
Any pain?
No.
Any pain in your neck?
No.
Okay, we're just going to check your temporal pulses, which are good. And I'm just going to go through here and just feel for any of your lymph nodes coming down. Do you have any tenderness or soreness anywhere?
No.
Okay. And as I move through her clavicle, I could just pinch to check her skin turgor, and it all looks good. Her trachea is midline and good. Any problems swallowing?
No.
Can you give me a swallow? I'm just going to go behind her and just look at her skin, noticing it's cool to the touch, there's no moisture. I'm just going to check her thyroid real quick, and all of that seems good. Okay. And as I look at her, I'm noticing that her face is symmetrical, her eyes, her nose, her mouth. Can you smile? Nice. She has good color. Her mucous membranes are nice and pink. I'm just going to check her. Can you stare straight over there for me? And again, stare. Nice. Okay. Can you keep your eyes fixed as you follow? Stay fixed on it as I come in towards your nose. Okay, her eyes are reactive. And can you put your hands out for me? Okay, flip them over. I'm just looking at all aspects of her skin while she sits here. And she looks really good. I'm gonna look in her mouth. Okay, she has no oral lesions. Her uvula is symmetrical. And can you say to me, you can't teach an old dog new tricks?
You can't teach a dog old tricks. New tricks.
Close enough. Now, I did say that her pupil size was reactive. She had good convergence. Look at me. She has a good slap reaction. Can you smile? Can you puff out your cheeks? Okay. Now I'm going to just check her carotid. Only one at a time. Never want to block the carotid. This side. This side. And we're just going to listen for her carotid. Just sit. Now we're also going to turn it around and check with the bell. Okay, very good. Okay, now we're going to move on to her chest area, where we're going to look for any signs and symptoms of any respiratory distress, and she doesn't have any. I'm noticing the size and the shape of her chest, and it's very symmetrical. I'm not noticing any problems with her rhythm. Again, her skin is in perfect condition, and she doesn't have any pacemakers or anything that I would have to see. She doesn't have anything on her arm that I would have to be concerned about when doing vital signs or anything like that. And you don't have any pain in any areas?
No.
Okay. And have you ever been told you had a heart murmur?
No.
Okay, I'm going to check that out for you.
Okay.
First, we're going to check with the diaphragm. You You can just breathe normal. I'm just going to be touching near your breast area if that's okay. Okay. And if it's okay with you, I'm just going to do that one more time with the bell of my stethoscope.
Okay.
Thank you. Okay, that's good. I'm just going to move to your back and check your lungs.
Okay.
Starting below her scapula, I'm going to move along each side of her vertebrae. Can you sit up straight for me?
Yeah.
Thank you so much. Deep breath. Again. And I'm working inner, side to side, and then I'll be moving laterally. One more. Over here. And one more. Okay, good. We're going to be moving on to the upper extremities. You don't have any kind of weakness or anything that I should be aware of. No changes in sensations or temperature. You haven't noticed any color changes in your skin and your upper extremities, right?
No.
Okay, I'm just looking at the condition of her skin and checking her for capillary refill, which is good. I'm not noticing any problems with her range of motion at this time. We're going to have her lift her arms up over her head, touch hands. Can you put your arms behind you? Just checking for some basic range of motion. If you could put your hands out in front of you and do a dorsal flex and flexion. No problems whatsoever. Fingers out, fingers in. All your range of motion looks to be good. Her skin temperature is good. Her skin moisture is good. I'm just going to check her brachial pulses right here. I'm going to move down to her radial pulses. I'm going to ask you just to stand up for a quick second. I'm just going to ask you to hold your hands out in front of you and close your eyes. Do you feel like you need to sway, like you're falling in any sort of direction, anything like that when you stand?
No.
Okay, good. You can have a seat right back down. Thank you. And like I said, you don't have any tenderness anywhere, nothing like that.
Nope.
Okay. And now can you stick your hands out like this and do the fingers to your nose? And again on this side. That's great. You shrug your shoulders up for me. Nice. Push your head to this side. Nice. Push your head to this side. Same strength. Put your arms up here. Don't let me pull them away. Nice. Now push me away. Nice. Okay. So we're going to be moving on to the lower extremities. You don't have any problems in your legs, any weakness, arthritis?
No.
I'm just going to look at your legs as much as I can. I'm going to see, we're checking for any type of scarring, lesions, any sort of pitting edema, any characteristics of that. I'm going to also check for capillary refill on her toes. She has beautiful orange nail polish, so it's not the easiest thing to see. We're going to check for her pedal pulses. Just going to put your feet right up here. All right, in here. And then we're going to check for her posterior, which aren't always easy to find. Can you take the heel of one of your feet and rub it up your leg like this? And do the other side? It's called shin to knee, like in the front, shin to knee. Very nice. Push your legs up against my hands. Nice. Push against me. Don't let me push you back. Pull me away. Push up, push down. Nice. Okay, I'm just going to pull your pant legs back down for you. I'm just going to do a quick Babinski reflex while I have her here, which is from the ball of the foot up to the big toe. She twirled her toes in, which is perfect. She didn't have any fanning, which is great. Okay. Squeeze your lower extremities. Okay. Trying to make sure we covered everything. Dorsal pedal pulses, palpate. Moisture. She also had, she had no remarkable skin, anything's on her body. And now we'll be moving on to the abdomen. Sit. Okay, do you want to get up?
Yeah.
Okay, we're going to go over and lay down, but while we're going over to lay down, can you walk across the room just doing heel to toe, just so I can watch your gait for steadiness? Toe, heel to toe, heel to toe. Perfect, come on back. Great, can you turn around? I'm just going to look at your hips and your spine. Let's check everything out from the back. Again, the entire time I am assessing all areas of her skin for any marks. She has no curvatures here. Her hips are symmetrical. Can you lean forward a little bit to touch your feet? No discomfort with bending? Bend your head down. I'm just going to check your spine. No curvature. It's beautiful. Okay, stand up.
Okay.
If you wouldn't mind coming over and laying down. And I should also point in that after I knocked, I provided for privacy. I washed my hands. I saluted that. Okay. And we're going to have her lay down. Here, we're going to provide coverage. That's great. I'm just going to look at her abdomen right now, and we are looking to inspect it. We're looking for contour, symmetry. I'm noticing that she has a piercing, but it is dry and intact. There's no signs of redness. It is not warm to the touch. Her skin is in really good condition. Which mine was that good? Her umbilicus is midline, and she has no type of scars or anything. So now we're going to auscultate, starting in the right lower quadrant. We're going to listen for bowel sounds. In all 4 quadrants, I should hear 50 to 30 per minute. Begin down here. Okay, now I'm just going to listen for the aortic, the renal, and the femoral. Now you don't have any type of abdominal discomfort at any time.
No.
Nothing hurts you. You're not constipated. You have normal bowel movements.
Mhm.
And as a female, you have a normal, regular period. You don't feel like it's overly light. You don't ever feel lightheaded or like you're not feeling good with periods.
No.
Okay. Is it okay that I palpate?
Yeah.
Okay, we're just going to palpate. We're feeling for any lumps or masses or any signs of discomfort. If she had a sign of discomfort, I would wait and assess that area later. And she doesn't have any signs of any discomfort. I should mention that during the entire assessment, I didn't notice any deformities. She had no swelling, no body temperature changes. Her reflexes were fine. Her heart and lung sounds were fine. Her pulses were strong and equal bilaterally. Her eyes and everything were in good condition. And if she were coming in because she was having any right-sided pain, I would do the lumbar pain sign where you push down and just bring up. And if she had a rebound pain, that would be a sign of an appendix problem. Okay. Thank you so much.
Yeah, of course. Bye.